Hey everybody, it is your girl Camila, and today is 4 weeks to the day post FFS, and I just wanted to check in and give you all an update. I know I haven't posted anything in a while, but there really wasn't much to report. So I shaved off my eyebrows because I wanted to kind of get them even again. They're kind of going crazy, and yet still I'm struggling with symmetry, so don't judge me too harshly on these bad boys. Swoop. Anyway, my face, as you can see, is healing great. He kind of did the brow ridge pretty well. It's healed pretty good. The incisions are doing really good. They itch, and hair has started to fall out along the incisions, but I know it's going to grow back. My chin is starting to get its feeling back. And my lip does need like a little bit more fat injection, but I think I'm gonna go a little bit bigger anyway. And yeah, really excited to have kind of gotten through the other end of this procedure. It just required a lot of patience. I'm still a little sore and swollen down here from the tracheal shave. I didn't realize it was going to be so intrusive. But yeah, also really looking forward to getting past the 6 week mark, which I still have 2 weeks to go, obviously. So I can get back on my electrolysis hair removal train. Sorry, my lips are a little dry. So that so I can get rid of all this like masculinizing facial hair crap. And it's been a little challenging for me. It causes a little dysphoria, but and I'm not comfortable shaving my chin yet as often because I can't feel it, and so I'm afraid that I'm going to cut it really badly. And it just kind of does feel like it does kind of have this weird sensation and a little bit of stinginess that kind of, after I put any kind of pressure or anything on it, kind of feels a little weird. So there's still a little pain here. The stitches will not go away. Slowly but surely. I was having a conversation with somebody over the weekend, and I could feel a stitch start to slip out. And I had to swallow it so it didn't kind of like fly out of my mouth. It was kind of embarrassing, but I mean, it's pretty manageable now. It still feels a little funny here. It's still a little. Actually, I have feeling here. Wow, didn't realize that I had feeling back in my forehead. It kind of itches every once in a while, probably because all the swelling and stuff and it gone away, and so my skin's kind of like retracting and everything. So I actually have a surgery scheduled June 24th. I'm going to be getting my body feminization, which is a lipo and BBL, Brazilian butt lift. So I'm really excited about that. And I feel like I'm just going from one to the other, which is great because I really would like to put this whole medical transition portion of my life behind me as fast as I can. I'm really excited to get to the other end. What else can I tell you? I'm not dizzy anymore, although I do have to limit how much I stare into the screen, whether it's my laptop or my phone. I have to kind of take breaks and look away, or I start to get a really bad headache, just because it takes a lot of concentration, and there's a lot of movement here that causes a little strain where I'm still healing, and the incisions are still sore, especially behind my ears. Still really hurts a little, when I if I sleep on the side, and so in the mornings it's really sore, and then at night I think I don't know if it's from sitting up or all the movement I do, but I start to get kind of sore on my incisions, and there's this little knot right here that I'm hoping will go away. If not, I don't know if my doctor's gonna have to aspirate it, but I see him June 6th, Dr. Pomerantz. I'm really excited about that. The office has been really great. They keep calling and checking up on me to see how I'm doing. Overall it's been a really great experience. It was rougher than I expected. I'm sure the experience is going to be different for everybody. So if I tell you that I'm having a rough time, that doesn't mean you're going to have a rough time. We're all different. We all have different pain tolerances and stuff. So please don't let any of my videos scare you. I'm sorry if I have scared anybody. But I'm just trying to keep it real, too. I don't want to sugarcoat anything for people. I'm not trying to scare anybody away, but I want to give people a realistic expectation of what the possibilities are for what this surgery kind of has to bring to the table. Just so you know what to expect. But, I mean, I can confirm that Tylenol does help. You're not going to have to eat a whole bunch of it while you're recovering. It's pretty manageable, so there were some points where it was difficult. And for me, sleeping especially was really hard, sleeping on my back. And I was dying to be able to sleep on my side. And so now that I'm able to I'm getting a lot of really good sleep. I still wake up with this side kind of, like I try to stay off of this side. Just because it's this, I think this is where he started to do this symmetry, and he's going to do this side next time. He only had a limited amount of time. And the reason that that happened was that, he had set up a tentative date and then it got canceled. And they had like a switch with the scheduler that does the surgeries, and somehow my name got lost along the way. So he tried to do everything. He did everything he could to move the surgery up to a date that wasn't going to be like 6 months down the line, because I had already waited a couple of years. It had been pushed back before, just because the process can be like that sometimes. And so he knew that it was really important for me to have work done, so they did what they could to find a slot for me just to get something done to alleviate some of my dysphoria. And I felt that was really, really amazing. They did everything they could. I don't know who they bumped or who they canceled or what happened, but they made it happen. And so where my date was only pushed up a month from when it was supposed to have happened. And initially they had told me that I might have to wait another year. So that was really kind of it was a huge relief, weight off my shoulders. And it broke my heart at first when I thought I might have to wait yet another year. That's why I really recommend Dr. Pomerantz, the UCSF team, and everything. They really do their best to try to help consolidate all the emotional turmoil that can come with transitioning and the waiting process and everything. So that really counts for a lot for me. I don't have any experience with any other doctors, but I have heard different things, from different girls about other surgeons, and like they weren't getting feeling in their face back, and they had frozen, like facial reactions in certain parts that weren't normal. And so I can definitely attest to the fact that everything is starting to feel normal again. I can move stuff. My lip is still a little bit numb here, and it's a little uneven, but I know that he'll fix that. I've always had a crooked lip anyway, so maybe as he was working on me and it swole, maybe there was only so much he could do. I'm wondering even if he was able to even get to the lip augmentation, because the more I see it, the more it doesn't look like he was able to do it. But that's what's exciting about the next time. So basically he did from here up, and then he did shorten my chin, which is amazing because I hated my chin before. So yeah, I hope everyone's doing great. I'm going to try to keep you up to date. I do start summer school next week, so I'm probably going to be busy. I don't think I have a huge following, so there's not a whole lot of people that are waiting to hear from me. But for those of you that are, you're still really important to me, and I still want to keep visible for you guys. Even if it's a small audience, I think that's still very important. So, if you have any questions, just put it in the comments. If you want to like and subscribe, that's awesome. I don't know how long this channel will go. It probably will go on for a while because I have quite a few procedures coming up. I have vaginoplasty February 7th. Like I said, I have my lipo BBL body feminizing June 24th, and he's going to break that up into two. He has to break it up into two procedures so he can get me snatched, because I don't want to get a tummy tuck, and so we have to break it up. And then I'm going to have vocal cord surgery at some point. I'm kind of going through my second round of speech therapy stuff again. So, and that has to be last. And then I'm probably going to have a fat transfer to my breast area, just because my breast augmentation is great. It's awesome, but I feel like I need a little more volume to kind of balance out the proportions for my body, because I'm actually pretty tall and I have a wide rib cage. So what might be really big on someone else kind of looks like a C cup on me, and I think even though it's not a C cup, it kind of looks like it. It just doesn't seem to fit right. So I'm going to have that adjusted. What else are we doing? Oh, and then, yeah, I still have another FFS procedure. So there's much to look forward to, and there'll probably be a lot of update videos for my friends and family, just so that I don't have to call in everybody, and so they can kind of see for themselves what I'm going through, but also for all the girls out there that have questions and just need other people to kind of share their experiences. So I guess that's it. I'm trying to think of other things that I've seen in videos that maybe need to be covered a little bit more, but I also like to try to keep my videos short, because I know it can be kind of hard to sit through a lot of the diary aspect of things for some people. Some people just kind of want to, I have attention deficit, so I kind of like things to get to the point and be kind of short and sweet. Otherwise my attention starts to drift. But in any case, I'm doing the best I can. I feel good. I feel pretty. This is definitely different, and I really like that. Have a wonderful day.